My name's Bill Kvasnicka. I'm a retired veterinarian, and I have been working with Intervet for about 12 years now. My interest is in applied field parasitology. Prior to that, I was in an extension position with the university. I was in practice and at a USDA meat animal research center for quite a few years. So that's my background. And as I'm retired, I specialize in the parasitology area. And I'm basically manage the database for Intervet Schering-Plough. Okay, the database is a repository where we accumulate and store all the data from field fecal egg count results and from experimental trials where we get fecal egg count reduction tests. We store it, and then we're able to retrieve it and generate reports that are reflective of the prevalence of parasites in the United States in treated and non-treated cattle. And we have 28,000 entries in there as of July 2009. Okay. Some of our data goes back to 2003. The primary addition, or the great number of additions, have been in the last couple of years when we've had a concerted effort at these fecal egg count reduction tests. It's pretty significant data that we get out of that compared to just general field prevalence data. Okay, the fecal egg count test is set up in the field, and we collect samples before treatment and after treatment. We treat them, and then 14 days later, we collect samples, and we can then enter all that data in the database and calculate the percent reduction to determine if the product worked or not. If it's under 90%, it was not satisfactory. It did not live up to expectations. A veterinarian could contact a producer, give them a basis of the fact that we can evaluate how your parasite control program is working with these fecal egg count reduction tests, and then that data can be used for educational purposes and to help you, in particular, design an effective parasite control program for your farm, your ranch, in the state where you live. The data we enter comes from parasite evaluation clinics that are held in the field by veterinarians and consultants, and by samples that are mailed into the diagnostic labs. There are 4 of them in the United States that work with Intervet Schering-Plough. And that data then is all accumulated and sent to me, and I entered it in the database. I think the database it's particularly valuable right now. It's going to become more valuable as we get new products and new treatment methods that we want to evaluate and see how they're working, make sure they're working over a period of time. And so, a continuation of the database is important to keep track of what's happening in the field of veterinary parasitology.